My name is Jenna Johnson, and I'm a graduate learning specialist with the Graduate Studies Support Center. I want to welcome everyone to our meeting today. Thank you for being here for our reflections on the impact of social media on teens' mental health with Dr. Susan Drummond, sponsored by the SOHP IPE Advisory Committee. Just a couple of housekeeping items before I turn it over. We are in a Zoom meeting, so please keep yourself muted unless you wish to ask a question. We do encourage comments and questions. You can use the Q&A feature as well as the chat. And I am currently recording our time together. If you'd like to rewatch or know someone who's interested in the recording, the video will be posted on the Graduate Studies Support Center's Skill Up page within 24 hours. And with that, I will turn it over to Dr. Myers for introductions.
Hello, everyone. My name is Alice Myers. I would like to introduce Susan Drummond, but before I do that, I would also like to ask everybody to turn off their cameras so that it doesn't interfere with the streaming. So Dr. Drummond has been a nurse educator for 26 years and an RN for 40 years, even though she's only 29 years old. Working in multiple areas of nursing, including med-surg, orthopedics, pediatric and adult oncology, intensive care, operating room, mental health, gerontology, and supervision. Dr. Drummond is an adult gerontological nurse practitioner and a clinical nurse specialist in gerontology. Dr. Drummond received her PhD in nursing from Azusa, I should have asked her how to say that, Pacific University, and a master's degree in BSN from California State University in Dominguez Hills. She also has a BS in healthcare management from Laverne University and an MP certificate from California State, Los Angeles, and an associate degree from Riverside Community College. Dr. Drummond's doctoral dissertation was on feeling overwhelmed in mothers of children diagnosed with diabetes. She's currently the department chair of nursing at National University, and Dr. Drummond works with the American Psychiatric Nurse Association as a facilitator in suicide prevention competency. So Dr. Drummond, please take it away. Thank you very much for being here.
Thank you so much, Dr. Myers. Can everybody hear me okay?
Yes.
Okay, great. I'm going to go ahead and share my screen. Thank you so much for coming and being here on today about this really, really important topic that I hope that by listening today that you will, if you don't know already, you will realize what a significant topic this is and how if we don't start acting soon, we're going to have even more of a crisis on our hands. So as we get started, can everybody see my screen okay? Everybody can see the PowerPoint?
Yes.
All right, wonderful. The first thing we're going to do is just take a quick, there's going to be about 5 questions that are polling questions. And so Jenna has kindly agreed to do the poll. So she'll put the poll up there. If you could just let us know what brought you here today, what is your position? That would be great. We could see who is in the audience. This is wonderful. Wow, look at all you graduate students. Awesome. Congratulations. Glad you're here. Faculty, thanks for coming and supporting us. And thank you to the staff who are here. This is great. It looks like we got everybody answered. So thank you so much. The majority are graduate students. So that's awesome. Hopefully this will inspire you to find some research area related to this topic because there's a lot of holes in the research that we need to fill in. So that's awesome. Okay. Jenna, can I just exit out of this? Is that okay? Or you got it on your side?
Yep, you're perfectly fine.
All right, perfect. Thank you. So, Surgeon General advisory. What do you think of when you think of a Surgeon General advisory? I always think of cigarettes and a label that went on the cigarettes to say don't smoke because it's going to cause cancer, right? So our current Surgeon General is Vice Admiral Vivek H. Murthy, and what is a Surgeon General advisory? We hear it on the news. Well, it's a public statement that calls American people's attention to the urgent public health issue at hand. So in this case, we are looking at a Surgeon General advisory related to social media and teens' health. This is the document if you're interested in reading it for yourself. It's 2003. It calls attention to the growing concerns about the effects of social media on youth mental health. It explores and describes the evidence, and we're going to look at some of that evidence. Now, it looks at both positive and negative, but the majority is negative in the report, and we're going to focus on that piece. I want to put a disclaimer that we are aware and research is aware as well that there's benefits to social media as well. However, there are some very much warning signs that we need to think about, and so that's what we're really going to focus on here. The first thing we want to look at is usage, influencing factors in brain development. So what is the current usage of social media? About 95% of youth ages 13 to 17 use social media. More than a third say they use it almost constantly. And although age 13 is commonly the required minimum age used by social media platforms in the United States, nearly 40% of children aged 8 to 12 use social media. My grandson is 13, and I am very much into this topic because I am the person that has a cell phone and monitors what he can and can't do. So this is an important topic for me personally as well. So what influences whether social media is positive or negative? So the time that the child spends on social media, the type of content, the activities they're engaged in, their individual strengths and vulnerabilities. Do they have stamina? Do they have grit? Do they have the tools that they need to push back on the vulnerability area that they may encounter? The health, is it affecting their physical health and their sleep? Those are two big areas that the research shows is being affected by the use of social media in children. And then cultural, socioeconomic, and historical factors. The brain development during ages 10 to 19 is not, it's underway, it's in progress. And so the brain is not fully developed. And so because of that, there's a lot more reason to be concerned about social media use. And we're going to start from the left bottom on this diagram, the highly sensitive years. Risk-taking is at its peak in the adolescent age. The next one is self-worth. You're forming your identity. And those of you that remember, Erickson's work and what are the developmental tasks of each age. Well, this is the time for those things to be developing. And if somebody is constantly being told that they're not good enough and that they're being bullied and things like that, that can really have a negative effect, of course. The amygdala, which is part of the brain that's responsible for the emotional development or emotional changes, that is important for learning and behavior to develop. And if it's still being formed and these social media is hijacking it, that can be problematic. And then the prefrontal cortex changes related to impulse control, emotional regulation, and moderating social behavior. Emotional sensitivity. I mean, I remember when I was a teenager. Do you remember when you were a teenager? It is a very stressful time when you're trying to figure out who you are and what you're about and what life's about. It's just a very sensitive time, and therefore negative input can really be damaging. All right, we're going to look at some research. The first research study we're going to look at is a natural experiment that was done across colleges. Now, I know we're talking about teens, so this is more of the older adolescent, right, going into college. They looked at 359,827 college age youth, and they measured, they staggered introduction of social media to this college age group. And what they found was an increase in depression, 9% over baseline and 12% increase in anxiety over the baseline. If you multiplied this out by all the colleges in the United States, that would equal about 300,000 new cases of depression a year. So the risk that the authors of this study suggest is that social media exposure to children and adolescents is even going to be more problematic than it would be in the college age population. The next study will looked at limiting social media, and another one on deleting social media. So current usage, there was a study that measured 8th and 10th graders. How much time did they spend on social media? It showed 3.5 hours per day that they spent on social media. Then they did a study on limiting it to less than 30 minutes a day, and they found that the depression scores, as measured by the Beck depression inventory, they improved by 35%. So there was quite an improvement for those that limited social media to 30 minutes a day or less. And then another study that deleted social media over a 4-week period, and it improved subjective well-being by 25 to 40%. So this says the Beck depression inventory, just BDI 14.5. If you're not sure what that scale is, normal is 1 to 10, and extreme depression is at about 40. So if you're at 14.5, you have mild mood disturbances, and it goes up from there. Some more staggering statistics. Again, in the study with the 8th and 10th graders, we already said that they spend about an average of 3.5 hours on social media. However, 1 in 4 of 8th and 10th graders spent greater than 5 hours on social media, and 1 in 7 spent greater than 7 hours a day. So again, concerning. Another study was a longitudinal study, cohort study in the United States. The variable was the group that spent less than 3 hours a day on social media, and another group that spent more than 3 hours. The participants were adolescents aged 12 to 15. There was over 6,000 subjects, and the results showed double the risk of experiencing poor mental health outcomes, including symptoms of depression and anxiety, for the group that spent more than 3 hours a day on social media. So let's look at some statistics. It's hard to fight with them, although it can be done. We can push back on statistics, but some things just speak for themselves. So I'm going to have Jenna launch the next poll. What percentage of teen girls experience sadness and hopelessness?
Dr. Drummond, can you see the results coming in?
Yes, thank you. Yes.
Perfect.
Can you?
Yes.
Can everybody see them? Okay, great. I'll go ahead and end the poll just in case there may be people that can't do it. So we'll stop at 27 and share the results. And it looks like 37% of you got the right answer. At 57% of teen girls experience sadness and hopelessness. If you add boys and girls together, it's 42%. Okay, so we're going to keep going here, and I've got to see how to get rid of the poll. It's in my way, but that's okay. As long as it's not in your way, we're good. Can you all see the screen without the poll there?
Yes, I can.
Perfect. So the girls who persistently felt sad or hopeless increased dramatically from 2011 to 2021. In 2011, about 36% of teenage girls felt that way. And in 2021, 57%. So quite an increase. And you can see that compared to the boys. So this is an easy give me question. Jenna will launch the poll. Is this percentage higher or lower than boys? I've kind of gave you the answer already. So we'll see who's awake and who's asleep. All right, so 76% got it right. Yes, it's the girls is higher than boys for sure. All right, so 3 in 5 girls felt persistently sad and hopeless in 2021. That is a huge number. And here is the graph that shows you the difference between boys and girls. Again, it started out for girls 36% and boys 21% in 2011, and now we're at 57 and 29. So it's gone up for both, but significantly more for girls. All right, we're going to watch our first little video clip. There's several video clips during this. The first one is just kind of on an overview of just an overview about what we're going to talk about. So I'm going to go ahead and scroll over to this. Hopefully, let me know if you can't hear it.
Savannah Sellers joins us now on set.
You guys are the morning news now anchors right now.
It is good to have you back and on such an important topic. What did you find in your reporting?
Yeah, it's so good to see you guys. Thank you so much, and so good to see you all at home. So there is so much going on with teens right now. Honestly, I think it's just harder to grow up now. If you think about social media, it's just this constant access to information. A lot of it's hurtful. It's body image issues. It's your friends hanging out without you. I heard FOMO a lot in reporting this as an issue that teens really say does impact their mental health. And then, of course, there are just the normal stresses that we all know about, the pandemic, climate change, and a big thing for a lot of these teens, they told me they actually think about every day, is the possibility of a school shooting. They go to school worried about that, and they have a really hard time with it. All of that sort of is culminating in that number that you said, 42% of teens saying that they feel persistently hopeless. Here's what's kind of really scary, though. Girls are faring much worse. 57% of girls say that same number there, persistent feelings of sadness, of hopelessness. And then the really concerning thing there is that sexual violence is spiking. So young girls are also dealing with that. They're dealing with this sort of misogynistic content that's online that they say impacts the boys that they interact with all the time. It's just a confluence of a lot of really concerning factors.
Okay. So what kind of harm is coming from exposure to the content on social media? Well, it's easy to get extreme, inappropriate, harmful content. In many cases, all you have to do is say, yes, I'm over 18, and you can get into almost anything you want to get into. Things are spread through direct push, unwanted content exchanges, and algorithms. And you've heard a lot about TikTok and the way that TikTok and other programs actually target teens and get them to really engage in what becomes an addictive cycle. And then in certain tragic cases, childhood deaths have been linked to suicide and self-harm. And we've all seen those things in the news. A systematic review of more than 24 studies found that some social media platforms actually show live depictions of self-harm, like partial asphyxiation, leading to seizures, cutting with significant bleeding, and lots of other horrific things that are online and accessible to whoever wants to access it. Further, these studies found that discussing or showing this content can normalize the behavior. So repeating it over and over again or watching it becomes part of rehearsal. And that's a lot a lot has been done around rehearsal related to suicide. If it lowers the risk, or raises the risk actually, but lowers the inhibition that you want to act on it. All right, we're going to go to our next video clip now. Teens Under Pressure. The Teens Under Pressure series that NBC did, and all this is on the reference page, by the way, but this series, we're going to watch several clips from this particular series. It's very well done, and it has a lot of great information on this topic.
More time at school a day than you do at home.
What impact does social media have on you all? I think, as you pointed out already, there's a lot of good technology, but is this a factor in your negative thoughts and negative feelings?
During the pandemic, everyone was all on social media, like, oh, today I'm doing this, I'm baking today, I'm doing my Chloe Ting workouts, or whatever the case may be. And it was easy to just see all the great things that other people were doing and be like, oh, maybe I should be doing that, or I'm not doing enough.
So that comparison trap.
Yeah.
Negative.
Yes.
Yeah.
I feel like we all kind of get on social media for that kind of idea of escapism, and then it kind of just goes sideways in the sense where it can kind of become a trap of like, oh, I saw this video of somebody who's like working on their applications right now. That's what I'm supposed to be doing. Why am I on TikTok? Things like that. It just kind of becomes a constant battle of like the good and the bad, and every day somehow they're outweighing each other.
I think people also get really, really comfortable in hatred. They get really comfortable in that negative view on social media. Like, you're sitting there, you're scrolling, and you're feeling unproductive, lazy, that you can't do anything right, that something's wrong with you, just because everybody on social media has their lives together or is projecting that. And you're sitting there and you can't get off your phone. You're like frozen to it.
Could you each just kind of tell me in a sentence or close to it, the main thing that you want older people listening to know about what it's like to be in high school?
Sometimes there's times where I just need to vent to somebody, and I'm not expecting a response. A response is cool. I'd appreciate it, but it's not my expectation. I just need to get what's in my head out and just tell it to somebody, whether it be my mom, uncle, aunt, family member, counselor. I'd say, yeah, just acknowledge their feelings and just be open-minded as well.
When they try and reach out to you, or they try and reach out to somebody and try and actually express what they're feeling and try and actually get help for anything, I feel like you shouldn't immediately go to blaming them or judging them. Is just have an open mind.
I would say evaluate your role within the relationships that you have, whether it be students, your children, relatives, and see if you're truly supporting them.
I'd honestly just say, forget any ego, forget any pride. It's something that I've noticed has caused a lot of problems whenever parents are interacting with their kids.
I want to say, like, times have changed now. They're removing the stigmatism from mental health, and people are being more open with their emotions, and times have changed, so it's time to adapt and help the youth who are in need of it.
Very wise teenagers. All right. There is a section in the report about excessive use of social media and problematic use. There was a survey of girls age 11 to 15. 1/3 said that they feel that they're addicted to their social media platform. That would be 1 in 3. And half the teenagers report that it would be hard to give it up. And nearly 3 in 4 teenagers believe that technology companies manipulate users to spend more time on their devices. Now we're going to move to another topic, which is related to this, which is suicide. And I'm going to go ahead and play another clip from our teenagers who can tell us what's really going on.
Will they actually make the situation better, or will it go even worse?
How many of you, do you all know someone who has confided in you that they were having suicidal thoughts?
Yes.
Yeah.
Yes.
Every single one of you. Why do you think it is that we're all having such a hard time?
Part of me feels like we see what's going around in the world. We see what's going on within society. We can turn on the news and hear about a death, an accident, a murder, things like that. And we've almost become numb to it.
I just think technology has done a lot of great things for us, but it also has just completely overwhelmed us with so much of the bad news. So
Definitely. So it sounds like what I'm hearing right now is current events totally impact you. Is that right? Like you feel the stress of what is going on in the world that's negative.
I don't even watch the news anymore, but I hear it all around me. Everybody, like one person will say something and everybody will hear about it.
I think a really sad example of this, it was in my first period class, maybe a week or two ago. There was some doors slamming towards down the hall, and it was very, very loud. Like they were slamming them hard. And some people in my class were wondering, are those gunshots? Like, should we lock the door? It's just become so, even though it's such a small, tiny chance, it's still high enough that we are fearful that, oh crap, that can happen to us. Because it can happen to us. It's not like we're immune to all of this.
I have a show, an NBC News show on Snapchat, and I asked those viewers to tell me, you know, what are some things that you'd want to ask officials in a mental health capacity. The overwhelming response that I heard about was the anxiety that people are feeling about school shootings.
Crazy how like lockdown drills and stuff like that. Like it's obviously, you know, to stay safe is nice, but even having to worry about that is crazy.
And you do worry about it.
Yeah, I feel like everyone does, and at this point, unfortunately, should. There's always that possibility in the back of your mind because you spend more time at school a day than you do at home.
Okay, poll time. In 2021, how many girls seriously considered suicide? Okay, so, yep, people still answering. Okay, great. All right, most people said 1 in 5. The answer actually is 1 in 4. So more than 1 in 4 girls reported they seriously considered attempting suicide in 2021, which is up significantly from 2011, as you can see in the graph. More than 1 in 10 girls reported they attempted suicide, actually attempted it. 1 in 10. Just let that sink in for a minute. They attempted suicide in 2021, also increasing significantly over the last decade. And substance use of alcohol is also higher in girls than boys. This was an article that came out in US News talking about the rise of suicide in young children, ages 13 and 14. Researchers found that from 2008 to 2018, the suicide rate doubled in that age group from roughly 2 deaths per 100,000 in 2008 to 5 per 100,000 a decade later. In fact, now suicide is the leading cause of death for 13 and 14-year-olds. And before 2008, it was actually the researchers were talking about how they were really concerned about these results because it actually had gone down and they were expecting that. But what happened is there was a sudden and unrelenting rise, increasing by 2.5 times between 2008 and 2018. And social media sites launched, such as Facebook and Twitter, launched in 2004 and 2006. So it's definitely something that happened during that time, which researchers wonder how that's related. Social media may be worsening bullying, causing kids to constantly compare themselves with others, exposing them to all kinds of negative messages and pulling their attention to the screen rather than to real life. Okay, the next topic, that was suicide. We'll get back. We are definitely, I know this is depressing. It's depressing me actually, and I wrote it. But we are going to get to some things we can do about it. But before we do that, I think it's important for us to think about sexual violence. This was just really, some of the information here really kind of shook me a little bit about what's happening related to sexual violence and the link to social media.
It's very tough. Also, one of the things in there just startling, Sophie's saying that the posts she sees most are about sexual assault and rape. You, of course, know that there was another disturbing stat in this CDC report that says 14% of girls have been forced to have sex. I brought that up with this panel of teens that I spoke with when I was in Virginia. Let's listen to a little bit of that.
Does that surprise you all?
No,
Unfortunately not.
Not particularly.
which is a really sad thing to say.
Yeah.
Why not? What have you heard? What do you know from friends?
I mean, there's just kind of this unspoken language, I want to say, of like, let's say you know a friend who's going to a football game, you don't tell them, oh, it's at such and such school. Well, be careful, that area is known for, you know, not having guys who can control themselves and things like that. So it's sad because we all know, but it's like just now that the public's kind of coming to that realization.
I take the bus to work sometimes, and when I take the bus to work, I wear a fake wedding ring, I wear like baggy clothes, and just make sure that I look like not a woman. And I have to do these things just to protect myself. Like, it's very unfortunate, but that's the way it is. It's normalized, and yeah.
Exactly, it's so normalized to an extent where like nobody's asking, why are you wearing a fake wedding ring? Like,
Yeah.
it's reached a point where it's known amongst us, but it's not necessarily concerning to outside parties.
It's just taken in stride. It's like, oh, I did this to make sure I wouldn't get raped on the street. It's like, yeah, that makes sense.
Sounds right. Yeah.
Okay, poll. In 2021, how many girls report experiencing sexual violence in the past year? Okay, good job. So 40% of you said the right answer, which is 1 in 5. So almost 1 in 5 teen girls experience sexual violence in the past year, a significant increase from 2017. This is the graph, 15%. The top line is the girls. The bottom line is the boys. 15% to 18% it rose for girls, and 4% to 5% for the boys. More than 1 in 10 teen girls reported they had ever been forced to have sex. This measure increased for the first time since CDC began monitoring this measure. So again, a concerning trend. Now, when we talk about special populations, subgroups within the teens, the significantly impacted group that surfaces is the LGBTQ community. In 2021, more than 1 in 10 did not go to school because of safety concerns. Nearly 1 in 4 experienced sexual violence, and nearly 1 in 4 were bullied at school. So this graph shows the LGBTQ in turquoise and the heterosexual students in purple, and you can see the disproportion to their safety. In 2021, almost half of the LGBTQ students seriously considered attempting suicide. Nearly 1 in 4 did attempt suicide, and nearly 3 in 4 reported persistent feelings of sadness or hopelessness. Substance abuse in 2021, 1 in 5 LGBTQ students reported having ever used illicit drugs. And you can see in every single graph, the turquoise is higher on all of the charts. All right, time to try to get positive now that I've depressed everybody thoroughly. The good news is there's things we can do. And the first thing is what we're all doing, which is to research the topic, look into it, really consider that this could really be something that we need to do something about, right? And taking it seriously. We must take action and provide a way forward according to the U.S. Surgeon General. We can maximize the benefits and minimize the harms of social media platforms to create safer, healthier online environments for children. It is critical that independent researchers and technology companies work together to rapidly advance our understanding of the impact of social media on children and adolescents. Those are both from the report. So the report, at the end of the report, it goes into each category of different groups and what they can do. He starts out talking about what policymakers can do to strengthen the protection to ensure safety for children, develop age-appropriate health standards, require a higher standard of data privacy, pursue policies that further limit access, ensure technology companies share the data relevant to the health impact, support them to look at curriculum in schools that will support healthy environments, support increased funding, and engage with international partners. Technology companies are encouraged to conduct and facilitate transparent and independent assessments of the impact on social media, prioritize user health and safety in the design and development of social media products and services. Now, what we all really want to know is what can we do, right? What can I do for Nicholas, my 13-year-old grandson? What can we do for our kids? Create a family media plan. It's like a contract. I didn't mean to click out of that. Sorry, let me go back. Previous, there we go. A media plan. What is expected for your family? Who's to do what, how often, and on what sites? Create tech-free zones and encourage children to foster friendships, model responsible social media behavior. That's a big one. You'll see that in the little video we're going to watch in a second. If the parents are modeling connected to social media 24 hours a day, the kids are going to see that. Teach kids about technology, empowerment, reporting cyberbullying and online abuse, exploitation, and working with other parents to establish norms and practices around healthy social media use. So we're going to watch this last video. What can we do? What can I do about my child? This is from the American Psychological Association, and it's just a real quick little 4 points for parents.
Hi, I'm Dr. Mitch Bernstein, APA's Chief Science Officer, and we know that parents are looking for some concrete information on what to do about their kids' social media use. While we're hoping that tech companies and policymakers offer some systemic changes, here are 4 things you can do in the meantime. Number 1, kids are watching what you do. Make sure you as parents are modeling healthy and adaptive social media use so they don't accidentally learn bad habits from you about what you might unintentionally be doing in front of them. Number 2, make sure you're using all those social media controls so you are only letting your kids stay on each app during the hours you set and for as long as you want them to. You can also control some of the content kids are seeing online. Dig deep into those device controls or the social media platforms themselves and use whatever kinds of restrictions you think are appropriate for you and your child. Number 3, it's really important. Science suggests that you talk with your kids regularly about what they see on social media. Help them understand how much mis and disinformation is on there. It's important to remember that likes do not always mean that people agree with what they see. Even the profiles you see might not be real people. Help them to not make so many social comparisons with others, especially when the information they see might be curated or somehow filtered to look a lot better than it is in real life. And last, but certainly not least, watch out for problematic social media behavior. Protect your child's brains by making sure your kids are not staying online during times they should be sleeping, because sleep time is critical for their brain development. So on weeknights, make sure device and social media stops are at normal bedtimes so they get 8 to 9 hours of recommended sleep. Other things to look out for: if it interferes with daily routines and commitments, if they choose social media over in-person social interactions, and if it prevents them from engaging in regular physical activity, and more. Those could be warning signs. Hope this is helpful. Check out apa.org for more resources on how you can make some smart, science-based choices for your kids' social media use.
Practical things. So I want to just briefly touch on generations and stereotypes. So the silent generation, we're starting on the pictures, we're starting on the right top corner. The silent generation, a stereotype about that is that they're loyal, dedicated, faithful, and frugal. The baby boomers are the next two icons. We don't like technology. You notice I said we, and we roll other people roll their eyes about us because we use a lot of cliches. And that's a stereotype about the baby boomers. The Generation X stereotype is, I don't care what you think about me. It's okay. You can think what you want. And the millennials born 81 to 2000. And by the way, this is one person's opinion about the years. You can find lots of data that contradicts itself. But if the millennials are, everybody's a winner. Everybody gets a trophy, right? And then the stereotype about Generation Z, which is really the generation we're talking about here being affected the most, is 2001 to 2020 by this person's judgment. They're I want to be a TikTok influencer. That's the stereotype there. But what I want to tell myself and others who have children and grandchildren that are in this Generation Z, look at the good thing. Generation Z, their truth about them is that they're socially conscious, they're digital natives, and all the other things on here. But look at this, they focus on mental health and well-being. Well, isn't that great? That's something we can really capitalize on as we go to make plans with our children that are Generation Z to improve their mental health. The report talks about what children and adolescents can do. Reach out for help. They need a trusted adult, okay? And what does that trusted adult look like is important. Somebody who can truly be trusted. Create boundaries to help balance online and offline activities. Develop protective strategies, healthy practices. Be cautious about what you're sharing online. Protect yourself and others. And we've talked about these already, about harassment and abuse and reporting it. Then those of you that are graduate students, what can researchers do? Here, I recommend that if you're interested in this topic and you're in school and you want to do research on it, go to the report because it tells you exactly where the gaps are. I left that section out because I couldn't cover everything, but it tells you the gaps in the research and what we need to fill in. And so from a country perspective, we need to make it a research priority. And I think that the Surgeon General is starting that conversation by putting this advisory out. Okay. Now, what can we all do? So we need to increase the sense among students that they're cared for, supported, and belong at school. And that is whether we're teachers here or whether we have a connection to the schools. School connectedness is very important. These are my words, ditch the divide. We have a divide in this country. You've been living under a rock if you don't know that already, right? So we have the right and the left, the black and the white, the yes and the no, it's the this or the that. Well, when it comes to this topic and many others, there's a lot of gray. And so being able to really recognize that just because we fund counseling in schools doesn't mean that we don't support the family supporting our children too. It's not either or, it's and. And so I think we have to approach it from that perspective. Increasing access to health services, including mental health services, substance use prevention, and school counselors. And that is what the Surgeon General's, sorry, I went too fast, but what the Surgeon General is recommending as funding for school counselors and for other resources for the schools. Then implementing quality health education is a topic area. It needs to be medically accurate, developmentally appropriate, culturally and LGBTQ inclusive, and grounded in science. That can help prevent violence and reduce mental health challenges by equipping teens with essential knowledge and skills, such as negotiating sexual consent, managing emotions, and recognizing asking for help that they need. These are some things that I put on here to think about. This is what we focus on a lot in the inpatient psych units. Grounding in physical activity where you are connected to your senses, dancing, other things that ground you with creativity are very positive, right? Expressing feelings, very important. I wish I'd have done this more with my kids when they were little. When they're sad or upset about something, really talking it through, putting something on the refrigerator that has different emotions and saying to your child, even at a young age, hey, let's go look at the chart. Which of these faces are you feeling right now? And being able to talk about feelings and not just saying, don't feel that way. Don't be mad. It's not, it's not right to be mad. Well, they are upset. And so they need to share about that. Mindfulness and prayer, a lot of work being done on that. Limit social media. We've talked about that. Outdoor activities, nature, getting out in nature. There's research showing that's a good positive thing. And then, of course, getting nutrition, sleep, and rest. Okay, these are the references, and that is it. And I'm open to take questions. Thank you all for being here.
Dr. Drummond, the Attorney General, that's like a distinctly U.S. position, right?
Yeah. Mm-hmm. Yes.
Okay. There was a question about research looking at other cultures or societies, besides the U.S., where there are different social norms. Maybe there's young women are more protected or rare ownership of cell phones, that kind of thing. I wasn't sure if you were aware of any of that research.
Right. So I focus specifically on the United States in this presentation. So there are other things that we could, talk about related to world and global, but this is specifically on really focused on the U.S. Surgeon General's report.
Okay, perfect. Thank you. And Nancy, you have your hand raised. You're on mute.
I wanted to ask Dr. Drummond, because there is a certain amount going on in the media right now about states banning social media for teens, even up to age 18. And I was wondering if you wanted to comment on whether you thought that was a recommended way to address these issues you brought up.
Oh, that's a really great question. So I would think that's not a good plan, because when you start banning things, then it makes it more likely that that people are going to do it, right? We've learned a lot about prohibition and on other things that we've banned and now we don't, right? So I think we have to work with the companies and government to, and according to what, and I agree with what the Surgeon General is saying, which is we need to work together collectively with the government and the technology companies, bring them together to say what is reasonable, what are reasonable restrictions to be placed. We've done it on many other things. Why can't we do it on this? And those of us that remember social media starting, we remember all going, this is not a good plan. I mean, when I was young, there was a Playboy. If there was a Playboy in the store, it was behind a closed, gated, locked thing, right? You couldn't get access to it. Now you can click on something on the internet and get whatever you want. So there has to be limits. We knew that a long time ago, but now it's affecting our children. So what are we going to do as a society to fix that? Just like guns and everything else that we're not seeming to get a handle on that we need to. Thank you for the question.
Thank you.
Professor Richmond.
And I have one in the chat, and then we're going to go to someone who has their hand up. It says, how do you address schools continuing to use social media, which further enables the problem and process? Specifically, the person wants to take away daughter's cell phone, yet her high school puts their information out on Instagram.
So I kind of missed that last part. You took away the cell phone and what happened?
She would like to take the cell phone away from her daughter, but the high school puts information out on Instagram.
That's I will tell you, I'm so glad I'm not raising children right now. And I am not the expert on this. These are my opinions and what, I did research on the topic related to it, but I'm certainly not an expert. I think that if you are doing the things that we talked about with making sure your child is heard and loved and encouraged and can talk to you and can come to you, that is the number one umbrella of what needs to happen. And then really getting down and saying, hey, let's look at some cases here. I know there's it depends on the age. It has to be age appropriate too. But when you get to adolescence and you're talking about teenagers, these teenagers need to hear the stories about the girl that was 13 and very innocently put out information to somebody that took it and found her and murdered her. And I know it's terrible, but we need to be able to say to our kids, look, I don't want to scare you to death. However, you do need to know the realities of what's happening. We can't protect them from that. They're going to hear it anyway. Like the one girl says in the video, she says, I don't watch the news, but it doesn't matter. I hear it anyway. And so we want to be the ones to share that information. And not everybody has parents. Not everybody's lucky enough to have that. And that's why we need the support in the schools too. I don't know if I answered the question. I really don't know what to do about the cell phone. I think, you have to talking and having communication with them is the key.
Perfect. Thank you. Donnelly, I hope I said that right. You have your hand raised.
You did. I just am going to go back to the previous comment of how do we control the social media between the community and the actual technology or the companies. And that has already gone to the Supreme Court. It is actually a First Amendment issue that is being called because it's a freedom of speech that they have the right to put out. So that's why you're going to start seeing paywalls come up, because there is no way and this is being debated over and over and over again in the legal system of how to control some of this information and restrict this information. Similar as Susan was saying, the Playboy was behind lock key. That was a paywall back then. But is there a paywall now? What does a paywall look like for us today? And then access and things like that, because there was a person deciding, were you 18 enough to buy that cigarette or to buy that whatever? So you had those blocks, but in the internet, those things weren't built, and it is hiding behind that First Amendment. And that's a big argument forward for that. And then again, using it as a communication tool that then requires children to have to do it is quite cumbersome and the same possible. And it could be helpful at the same time, because I've had students who've had a first shooter situation, and that cell phone was able to protect those students, to get them in the area that they needed to, and to hide in the bathroom. And we're able to communicate with the rescuers. So again, I see both sides, and being a parent of children who have been in the first shooter situation. So that's what I wanted to say about the paywall and then the First Amendment. So it's going to be a big conversation for a long time.
Thank you, Donnelly. Gloria, you have your hand raised.
I do. Thank you so much. This was a fascinating presentation, Dr. Drummer. And I came in a little late, so forgive me if this question was already answered. But what about the children 6 years old, 5 years old, who are experiencing gender dysphoria and the movement in this country to facilitate their concerns with sex altering surgeries.
Right. That is, that's back to that one slide that I shared about, black and white and ditch the divide. For whatever reason, we think that there's only two ways about everything, and either the extreme right or the extreme left. And we know that maybe in theory, and I like to say, this is just my opinion, but I like to say if we were in the Garden of Eden, things would be different, but we're not. And so in theory, things sound great, but in reality, they don't. And so we have to work together as a team to resolve these issues. Is that going to happen anytime soon? I'm not sure. In this country, it can get very discouraging about that. I don't know if you saw this, it's not that age group, Gloria, but or Dr. McNeil, it's not that age group, but there is a lot of research on LGBTQ communities. And we know that there is disparity in health outcomes for certain populations. And those children, there's going to be disparities. We know that. And so how do we address that? I mean, that's a great question. I don't have too much of an answer for it, but except for that, we need to realize that we're not one way or the other, that there is a middle ground.
Okay, thank you.
And I see one more hand, Dr. Myers.
Yes. Hello, how are you? My question is at the very beginning of this presentation, there was someone in the chat room who brought up the statistics of teen depression, suicide, blah, 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 during COVID or as an aftermath of COVID. Has there been a correlation between increased social media use and being in the house by yourself and the increased depression rates, or is it really not related to the isolation that our teens experienced for 2 years, where they weren't with their friends or in their normal social situations?
Right. So yes, it absolutely plays a role. I on purpose left it out because it's in the report with a list of things. It's not just COVID, but a list of many factors that affect teens' health, right? What I tried to not just keep referring to that, because we do that. I believe we do that. And then we miss things because we blame everything on COVID rather than really getting to what is actually going on. We were having these problems before COVID too.
Right.
So, but yes, it absolutely made it worse. Yes. No question about that.
Thank you very much.
Well, I don't see, Donnelly.
I was just going to support Dr. Drummond. It was actually 135% increase during that time frame. And again, during that time frame, your social media usage increased. And that's when I think a lot of these studies found that they were marketing and piloting to these teens and pretty much just festering it up. Exactly what her presentation talked about. So, I mean, it just made it more reliable, where they didn't have the outside items to distract them from that technology, so they spent more time with it.
Right, thank you. And the gun violence is another factor that they brought up, the teens brought up, as you saw, and that's plays another role. Significant increase in gun violence in schools, as you know.
Well, and this is Alice again. I'm on a local school board, and it's for K through 8. And we have seen a significant increase in harassment, bullying, and fighting among this age group, especially in the 6th graders. And if we look back, in 5th grade is when cell phones are starting to be allowed in the school system. So the kids can start using their cell phones. A lot of them are complaining about chat rooms that they're in. The classrooms have chat rooms where bullying is going on. And we as a school board are looking at it and saying, what can we do to help? But what's really significant is that the parents do not want to limit the cell phone. They feel a sense of security with students having social media all the time. So, why are kids beating each other up and bullying each other more? And it could be because of the mental health.
Right. And you got to go into the software and see what's actually happening. Roblox and little children, Roblox has a chat. Roblox has the ability to bully each other at a very young age, and many other the programs. So I think we're all overwhelmed with life, and so it's difficult to keep track of that for your child to go in but you have to look at those things because I've learned a lot about it just by looking at Nicholas's things that he's involved in and saying, hey, this isn't appropriate, even though it's advertised for, an 8-year-old or whatever. So, yeah.
I think there's one more question too from Mr. Ball. I believe it's Mr. Ball.
Yes. Hello. Dr. Drummond, wonderful presentation. Really appreciate it. I just want to make a comment. It's not a question, more of a comment. I think all of us would agree that we would never, ever, as an adult, we would never, ever allow a 13-year-old, a 14, 15-year-old to drink alcohol, vodka, or whatever, right? Because we know the long-term side effect is addicting and so forth, right? I don't know why we allow a 13-year-old to be on social media. I mean, really. So in my opinion, we have to have accountability. Somebody has to be responsible for that. Yep. We cannot simply put all that burden on a child. If I am a 13-year-old, I do want to spend a lot of time on social media because I like that. Algorithm is set that way. If you're asking me not to do it, there has to be a better alternative for that. Give me something, give me something that's better than this, right? So number one, accountability. In my opinion, parents should be accountable. Just like if you find somebody, a 13-year-old having alcohol or smoking, we find out the cause. We do not simply say, oh, well, do some patient or family teaching and so forth. So number one, there has to be accountability. Number two, the problems are going to get even worse because now we have AI.
Yep.
And you multiply this by 1,000, so we know the impact of AI on everyone, including adults. So my take here is, it is a global issue, and it's just not limited to our country, of course, right? It's as bad as pandemic was or COVID was, and unfortunately, we need to act today. And number one thing that I believe we can do is start spending more time with our children. Do not allow these social media platforms or television to babysit our children. I think we need to spend time. Let's go out, spend time in the park, zoo, or whatever, and teach them that there are better things that are naturally addicted to us, like a nature and so forth, instead of giving them a cell phone. When parents, I know that parents usually have issues taking those cell phones away because they feel, oh, this is how I'm going to connect with my daughter or my son. When your child is in school, the best way to contact your child is you call the office. We should never be texting our children while they're studying. That's a bad habit. So it seems like there's a multifactorial issue here.
Thank you so much for those comments, Dr. Ball. I think you're right on. I agree wholeheartedly. The thing is, what do we do with children that don't have the support at home, that are coming to school and don't have the support, and how do we best help them too, and everybody, obviously. But yeah, your comments are well taken. Thank you.
And we do have a hand raised from Eve.
Hi, thanks for taking my call. This kind of adds on to my first chat question, but I really, I keep hearing parents need to take responsibility, parents need to take responsibility. And I will tell you, as a psychiatric nurse practitioner, as a military officer, as a parent of a 20 and 16 years old, this is a no-win situation with us. Schools use social media, colleges use social media. The job that my daughter gets at Legoland as a 16-year-old using social media. She even came to me the other day and said, Mom, see, TikTok isn't all bad. I learned how to do this and this and this from it. If we continue to have, like you said, Dr. Drummond, this black and white thinking of all social media or no, and I am the person that took them to the park, hiking, surfing, beach, anytime we could, even now, 16 and 20, I'm pulling them out of the house. But the bottom line is, this is the world that they live in. And if we continue to say, oh, no phones, no social media, or all phones, all social media, we as parents get nowhere and they don't hear us. At 16, 17, 18, brains aren't fully developed. They do not hear us. So unless we start coming together as a country for how we can effectively use it, I really think that the situation is going to get worse instead of better. So to all the parents out there who are not a unicorn and are able to somehow walk these two lines, I applaud them, and I hear you as a parent with so many degrees that says I should be able to do this just fine, and yet I struggle like every other parent out there. Thank you.
Well said. Thank you for those comments.
And Catherine, yeah, I think you're going to be the last one, Catherine, because we're at the top of the hour.
Okay, I'll try to be brief. I'm a parent and a student, and I also work. I happen to have 6 children, and I try to. I basically think that for me, I have found a way to try to somehow limit the damage that can come through social media by connecting with my kids' friends and just passing along the information. So I try to keep myself educated. I got about half the questions right, so there's room for improvement. But whenever I find out about, like, for example, an anti-porn app to put on our kids' phone, I passed that just 2 weeks ago to one of my kids' parents, and we are all using that now. And we are limiting. We have made a decision to limit the amount of time. There's an app where you can limit social media to 2 hours a day. I know 2 hours is still a lot, but so that's how I've been able to try to be proactive, but it's totally overwhelming. And I must say, from my older 4 kids who are not now adults, the statistics are right on as far as sexual assault and violence in school and all the different the problems with mental health and suicide ideation. The numbers are right on in my personal experience. And my kids were going to private schools. So it's very scary. And just quickly, another person mentioned about, was wondering about, 2 of you were wondering about the situation in other countries. So I'm originally from the French Caribbean, and we don't have school violence the way, I was shocked to see how those teenagers that were interviewed, how much the threat of school violence was affecting them. So I would say, I'm from the French Caribbean, but also from France. So my adult kids now live in France, back home, and they don't have to worry about gun violence either. They are college students in their college or even in the schools. So that's the only difference, but everything else is the same as far as, the I mean, social media is an international phenomenon, so it's everywhere.
Well, thank you for your comments. I applaud you. My hat's off to you. I mean, I love that you're sharing with other parents the things you find out and working together as a team to help your children. And that's great. I love that. I think it's wonderful. So good job. Keep it up. I know it's overwhelming. That's why I studied that topic for my dissertation, feeling overwhelmed.
Well, Dr. Drummond, I would really like to thank you. I think we've all learned a tremendous amount. I think you've opened up our eyes and our minds to what's that, because it's so easy to get so caught up in what we're doing that we don't think about, what the kids are going through. So I really appreciate you in presenting this to us. Everyone, please remember that there's going to be a recording so that you can download it. You can share it with your friends. It's on YouTube. So I really thank you. And I couldn't be more pleased. This was a wonderful presentation. So thank you.
Thank you so much. Thanks everybody for coming. Your time is valuable, and for you to come and be here with me today is very, very, very wonderful. So thank you so much.